Hi everybody, Dr. Andrew Hall here from WellSpine, Kansas City. I'm going to be going over the fulcrum exercises today with Alex. Again, a word of disclaimer here. If you have not directly been given these fulcrum exercises by either myself or Dr. Liisa, you're not ready for it. So if you're just surfing through YouTube and say, hey, that looks like a cool exercise to be doing, don't. These are prescribed specifically by a doctor. So there's your word of disclaimer. So the fulcrum exercises, basically the purpose of these are to take your towel exercises to the next level. We are going to be starting to rehabilitate the paraspinal muscles in the neck, in the mid back, and in the low back. It's going to give you better ranges of motion, and it's also going to help you deal with any kind of symptoms that you're dealing with, okay? So you see Alex right here is already laying on the table, and she has the towels placed where we want them. You'll see right down here, it's placed right at the elbow, and then right up here, just below the neck. It should be at C7, T1, where the neck meets the shoulders. That's where I want those towels placed. Again, if she's going through our protocol, she's already been able to lay on these towels for 15 minutes comfortably. So she's been working on this for about 2 to 3 weeks. And these fulcrum exercises are going to take the place of the towels. So once you get these fulcrum exercises, you don't have to lay on the towels for 15 minutes anymore, okay? So it's 3 exercises, 3 for the low back, 3 for the neck. I'm gonna start with the low back first. So Alex, go ahead and bend your knees and put your feet flat on the table. The knees and the feet should be together for this. And then Alex, I just want you to drop your knees off to the side here. So just go ahead and rotate them as far as comfortably can. Good, you'll notice that her hip will come up off the table a little bit, but the shoulder stays right down here, okay? So that's totally fine. So go ahead and come the other way. Good, and you see that rotation right through there. And she'll notice that there's a good stretch through the low back and through the glutes and things like that. Awesome, so it's 12 of those on either side. So once this gets a little comfortable, then you can take the exercise to the next level. So Alex, just let your knees drop off to the right and then turn your head to the left. And that gets a great stretch up in the mid back and in the neck. So go back the other way again, and then go back this way and turn your head to the right. Good. Awesome. Okay, back to center. That's exercise number 1. Exercise number 2, grab a hold of your left knee, just bring it towards you, grab a hold of it, hold it there for 2 to 3 seconds, and then bring it back the other way. And then let's do the right knee. That's basically it. Really, really simple to do this one, but again, there's going to be a good stretch in the low back, in the glutes, and also in the quads as well. And then the final exercise is just a good old-fashioned crunch. You only have to come a couple inches up off the towels, but here's how everyone screws this up, and Alex isn't doing this. They do this, and they strain that neck forward. Don't want you to be doing that because you're going to screw up all the work that we've been doing in your neck. So just keep the cervical spine in a really neutral position. Alex, cross your arms in front of you, and go ahead and just come a couple inches off of those. Perfect. And it doesn't have to be that much more than that, because the towel, especially here in the low back, is really going to focus on helping the paraspinals and strengthening them as well. Okay? So you can go ahead and uncross there. So those were the 3 exercises for the low back. Let's do the 3 for the neck. And these are just kind of a continuation of your warm-up exercises that you've already been given. So the first one that I'm going to have you do, Alex, is just go ahead and bring your chin up and back and push your head back into the table. Hold it for about 3 seconds and then relax. That's it. And I want her to do 12 of those. I want you to do 12 of those. This is a really important exercise for those of you who sit for long periods of time in this kind of position. That towel there is going to bring the head and the shoulders back up and over, and you're really going to get a great stretch and a workout in the back part here. Okay? Next exercise is, Alex, I just want you to turn your head to the right. And again, this is keeping the back of the head up against the table. She's turning to the right. You hold it for a couple seconds, and then you come back this way. And then let's go to the left. Good. Back to center. Again, 12 of those either side. And then the last one is I want you to bring your ear towards your shoulder there, Alex. Again, keeping the back of the head against the table. Good. Hold it for a couple seconds, and then back the other way. Awesome. Both of those are great. They're really simple to do. These exercises take about 5 minutes, but you're going to notice that your ranges of motion are going to improve. That tightness that you feel throughout the spine, especially after sitting for long periods of time, is going to loosen up, and you're going to notice better changes in your progress exams, your x-rays, all of those things. So I tell people to do these in the evening time. I want you to do them after your day has already happened, because the muscles are going to be warm, the ligaments are going to be warm. Do them after dinner, but before you start the nighttime routine. If you wait until you go to bed, you're not going to do them. You're just going to go to bed and fall asleep. Do it in between that dinner time, nighttime routine before you start putting the kids to bed or watching TV or anything like that. That's a great time to do it. Just takes you a couple minutes to do it, but you're going to see awesome changes with your care here. So keep up the great work, everybody, and thanks for your time.